Dear friends, ladies and gentlemen, it's really a great pleasure and honor indeed for me to be here on the platform of Moolchand Medcity. The topic given to me, how we can enhance awareness about hypertension and its management very meticulously, what we should know. As you all know, that we should not have a blood pressure at any point of time, ideally more than 120 by 80. If you are 40 or beyond 40, we must make sure that we have a habit of taking our blood pressure at home, what we call as home BP monitoring. But if you have a blood pressure where there is a lot of fluctuation, we should go for what we call as ambulatory blood pressure monitoring under the guidance or supervision of a doctor. What are the symptoms of a high blood pressure? Normally, there are no symptoms, except you may get a little heaviness in head or a little headache or a feeling of heaviness in chest or uneasiness or extreme fatigability. Now the question is, why should we have an awareness? Uncontrolled hypertension is like a global tsunami. It may create havoc with our life. So blood pressure has to be controlled. It may cause premature heart attack, lung attack, brain attack, eye attack, and even leg attacks. Because all these blood vessels may get dissected and they may get bleeding and all kind of complications. What are the common factors responsible for the high blood pressure? I am not talking of secondary hypertension. I am talking of primary hypertension. There are 6 or 7 S you should know very well. Number 1, stress. Please manage your stress in a daily routine by proper meditation and yoga. Follow all the 8 limbs of yoga: yama, niyama, asana, pranayam, pratyahara, dharana, dhyana and samadhi. Manage your stress and remain calm. Have attitude of gratitude. Number 2, S is salt. Don't consume more than 4 grams of salt. Excessive consumption of salt gives rise to high blood pressure. Number 3, sedentary life. Sedentary life is a very common cause of high blood pressure. I always say, use it or lose it. Move it or lose it. Our objective is keep on doing exercises, heart-friendly exercises like walking, jogging, swimming, dancing, cycling, treadmilling are the best exercises. Avoid heart-unfriendly exercises like push-ups or like weightlifting. It enhances the blood pressure. Number 4, smoking. Please make sure none of us smoke. Smoking is injurious for heart and vascular health and may cause high blood pressure. So we must completely condemn smoking. Today you smoke a cigarette, tomorrow cigarette will smoke you. Today you chew tobacco, tomorrow tobacco will chew you. So our aim is not to be a smoker and make sure we are also not a passive smoker. Then comes the next one is saturated fat. Avoid saturated fat. Omega-3 fatty acid consumption is the need of the hour. Take more omega-3 fatty acid and avoid saturated fat. The ratio should be known. 1:1:2. That means saturated fat 1:2 and then polyunsaturated fat 1, and the ratio should be 2 of monounsaturated fat. Fried food should be avoided. Too much of eating is not good. Pot belly should be avoided. Longer the waistline, shorter is the lifeline. Choice is yours. We should not have abdominal girth more than 90 centimeters in men and more than 80 centimeters in women. They always say longer the waistline, shorter the heart line. Then the next important thing is sleep. We must have adequate sleep at least for 6 to 8 hours, which really help and enhance our potentials. Have a sattvic life, and self-education for medication is the need of the hour. Go to a doctor as advised and don't take medication by yourself. You should have education. Take the medication meticulously. Controlling blood pressure will enhance your longevity. Ladies and gentlemen, a last message to you. Controlling hypertension you may grow younger and live longer. Please control your blood pressure. That is the need of the hour. I am speaking to you from the platform of Moolchand Medcity, New Delhi, India. Thank you.